All right, good evening. Thank you for joining us. My name is Faye. This is Live with Faye. We're going to do a quick conversation, taking note of the numbers that we're witnessing right now in what has been described as the second wave of COVID, particularly bad in Maharashtra, but numbers also increasing in the rest of the country. Let me just quickly take you through what the numbers are as of today. Not great, really. From the Municipal Corporation of Greater Mumbai, today we've reported 3,260 cases as of 6 p.m. this evening. I must remind you that the numbers weren't this high anytime most wave. Is reporting about 30,500 cases per day. Again, higher, much higher than the peaks that we saw last year. The Health Minister, Rajesh Tope, has said so far we vaccinated 45 lakh people. Every day, 3 lakh people are being vaccinated across the state. We're making arrangements so people can be vaccinated. Now, we've taken a look at the numbers in terms of beds and availability in COVID hospitals and COVID ICUs across the country. The BMC on its website has a dashboard that tells you how many beds are available, how many beds with ventilators, how many ICU beds. And it seems like in Mumbai, it's roughly about 50% capacity at this point, 50% occupied, 50% available. Pune, though, is a more worrying situation. For the third consecutive day, Pune has reported 5,000, more than 5,000 cases, which is again really worrying. Pune's hospital, the Deccan, KEM, AIMS, Jahangir, Sayadri, Diranath Mangesh Hospital, and Global, 0 vacant beds for COVID, which means that they're already at this point at full capacity. And a couple of other, I'm sorry, forgive me. I'm sorry about that. And a couple of other hospitals are 1 bed or 2 bed, or in some cases about 10 beds available. Symbiosis has 50 beds. DY Patil has more than 50 beds available at this point. The question that we're asking is, how dire is this? Because I've heard a lot of people argue about the fact that this is asymptomatic. So there's actually nothing to worry about. A lot of people are asymptomatic, so you can recover from it, which is why people are not as serious about this wave as we were the first time around. That's the question we're fundamentally asking. And joining me right now, Dr. Shruti Tandan of Jaslok Hospital, Dr. Mangesh Pate, he's the chairperson of the Indian Medical Association Hospital Board, Maharashtra State, and Dr. Nitin Shah is the section head pediatrics, PD Hinduja Hospital, joining us right now. Good evening, doctors. Thank you for joining us. If I would just ask Dr. Pate, if you've taken a look at the situation at this point, is it fair to say that this version of the virus is less dangerous because more people are asymptomatic?
I will definitely not like to comment in that fashion. We have to take into account a few facts over here. See, the COVID started in March 2020 last year, and if you recall, the stage what we achieved in first 6 months, that is till September 2020. That peak we have already achieved from 11th February till date. If you speak of, just now you quoted the figures of Mumbai, okay. If I say I reside in Dombivli, and if I speak of a Kalyan Dombivli Municipal Corporation, the last around say 11th of February or 12th of February, the cases witnessed were below 50 per day, below 50 per day. Today, the latest figure till 6 p.m. has shot up from 50 to 686 per day. Now, when speak of such a surge, and you only mentioned, and it is a fact that the COVID facilities, few of them were closed down by the government of Maharashtra. They restarted them. And let me tell you, many of these COVID facilities are full of their capacity. Now, definitely, there is a tremendous surge. But as I see the COVID patients every day, what I'm witnessing, I don't know, maybe Shruti also must be having the same experience in Jaslok. But definitely there are patients who are presenting to us with a saturation of a 70 and 80 this time also. And by passing such a comment that most of the cases are asymptomatic and nothing to be worried, I am against of any such a statement. Let me be frank enough over here.
Well, let me bring in Dr. Tandan. Dr. Shruti Tandan is, actually an intensive care specialist. She works at she's been looking after the ICU, the COVID ICU at Jaslok Hospital this entire time. What has been your experience of the second wave? What capacity are you at right now, Dr. Tandan? And would you recommend people be concerned?
Definitely. So it's, there cannot be a more appropriate phase than history repeating itself at this point of time. So I would agree with Dr. Pate, and exactly a year ago, we were in the same scenario. And it's a kind of a deja vu feel, because apart from the lockdown, everything was the same. We had similar surge in numbers, in fact, smaller. And we have the same kind of feel that yes, we have patients in the ICU, but we think we should be able to manage them. And patients, COVID doesn't seem to be such a sick disease. And in the last 2 or 3 weeks, we have seen that the patients are getting sicker and sicker. We've had to double our ICU strength from what we had brought it down to since the past couple of months. And now every single patient is in the ICU is critically ill. Previously, there were patients who were in the ICU just because they needed close monitoring. So because they had a neurological problem, or they had needed nursing issues, therefore they were kept in the ICU. Now every single patient there is critically ill. Today, just before coming here, we've had a meeting with the administrators of our hospital to increase the critical care nursing and to buy more equipment for the ICU, because we feel that these patients, we are juggling equipment between patients. That's not something that we even needed last year. So I would anticipate that yes, in the next few weeks, we are just going to relive what happened last week. And, a very important word of caution here is, I think a lot of people feel that either they've had COVID, so they are immune, because everybody keeps saying, I love this phrase that everybody uses, that I have antibodies. It's like some suraksha kavach that you acquired, like Karna. And I've been vaccinated, or I've got my first shot. So neither the presence of previous COVID nor the fact that you have been vaccinated are going to protect you. We have enough number of people in the medical fraternity alone who have received both shots and 2 weeks later have landed up contracting the illness. And though vaccination, yes, is a must, I would recommend everybody do it, but it's going to protect you probably from a less severe form of the illness. But if you look at the data, even after vaccination, you can land up with a severe disease. So it's very, very important. Faye, you said it on this show sometime back, to follow the SMS measures. I think that's the new way of life, and we have to continue that till this really dwindles down to a linger.
So effectively, we've let our guard down. And Dr. Shah is with us. Dr. Shah, here's the question. There have been some people who have questioned this point, that maybe our vaccination process is a little slow. It should be sped up. More people should be invited to get vaccinated. More information should be disseminated in maybe neighborhoods that don't have access to information about where the vaccines are available. Because we are at this point, looking down the barrel of a second wave, and a large portion of our population is not vaccinated. That's going to put pressure on our hospitals again, isn't it?
Absolutely. So if I have to say that the vaccine helps, so that's where I little differ from Dr. Shruti, where it says that actually if you have taken 2 doses of vaccine, it may not protect you against all severity. And that depends on what is the duration of the gap between the 2 doses. If I have kept 8 weeks, as I have been saying, going hoarse over last several months for all my medical people, that you don't take it 4 weeks. And today the government has actually said that now you can take it at 8 weeks. Then you would probably 90% chance that you won't get it. And if you get it, it will be mild. So it prevents against hospitalization and deaths. And I think that's a great relief. The problem is the ones who get into ICU with Dr. Shruti or Dr. Mangesh or whoever. I'm a pediatrician, so fortunately I don't have to really face this music every day. But those who go into hospital and ICU are the ones who are either going to be more than 60 years or more than 50 years, let's say, and those with comorbidities. And that's exactly the type of people who should have received vaccine first after the frontline worker. In fact, I sometimes even felt that a young RMO who is working in a public hospital is not at such a risk of dying of a disease than an elderly 70-year-old with diabetes at home. But yeah, frontline workers, yes, they did merit to get the vaccine first, and that's obviously what happened. But I think after that, if you by your own standard, if you say you vaccinate 3 lakh people per day, and then you take 30 lakhs in 10 days, or say 1 crore in a month, and you are talking about 35 crore people with let's say 30 crore people with those who are at present the target for beyond 60 or between 45 and 60 with comorbidity, it will take months and years for them to just give them. And after that, there's a huge people who are below 45 with comorbidities and young people. It's not that young people can't get it and not get hospitalized or die. I mean, my own relatives, some of them are young as 35, 40 without any comorbidities, had significant disease to be admitted. They're not in ICU. They all fortunately came out. But how much they wish that they had taken the vaccine. So I have a very strong view on this point about vaccination control, that, in democracy, uh, every person has a right to something which is life-saving. And let me repeat, vaccines are life-saving. So it should be, the choice should be left to the person, that if he wants to take the vaccine at any cost which is available, then he should get the vaccine. May not be the first priority, may not be the second, but the third priority. But by the way we are going about vaccination, only through public health to start with, then the private hospitals were roped in a little late, and then there are very few and the very strict criteria. They have to have 50 beds, ICU, etc. We are not going to be able to reach to this high-risk population. Forget about the normal population. And to me, any person who dies of COVID today, now that we have vaccination available since last 2.5 to 3 months, I think it's not justifiable, because vaccine could have saved that life. And mind you, there are people who are dying, and I know personally of friends who have died, who could have actually bought these vaccine manufacturers entirely. So much money they have, but they won't get it because they are 50 years and they don't fall into criteria, but they have diabetes. And one of my friend died just exactly like that. And it's such a pathetic situation. So I think earnest appeal from our association, Indian Academy of Pediatrics, and we have in fact sent a letter to the ministry saying that we are 40,000 pediatricians, and there are more than 1 lakh qualified IMA doctors, and you give 1,000 doses to each one of them, and they can do it in next 2 or 3 months, and you imagine how many more people you will be able to reach than what you are reaching through the system that you have as on today.
So, Dr. Nitin, I would want to differ here, because to say that it should be available to anyone who can pay any price is really not the fabric of a democracy. And then the vaccine will go to the highest bidders, which is really not the way it should be done. I mean, somebody in Dharavi has as much of a right to life as somebody living in a skyscraper.
Absolutely,
Also,
I agree with that, but
yes,
that's individual choice. And
yes,
what I'm saying is
about
that can continue through the public health.
pediatricians administering the vaccine in their private clinics also, I would strongly differ, because the vaccine is sensitive on a cold chain. And if you walk into one of these centers, you look at the way things are functioning. The BMC comes in thrice a day into Jaslok hospital to check that the cold chain is being maintained. How much this outreach is going to be possible? In fact, I would go a step further in saying most of my batchmates in my year migrated outside India, and many of them have reached out to me looking at how their parents are being vaccinated and said, we wish we would move back to India now and be part of this movement. That's the kind of pride and national self-esteem that this vaccination drive has generated. So I don't think I have any reservations about that. And we are saying that yes, everybody needs to be vaccinated. Vaccination is preventive, but all that I'm trying to reiterate is that vaccination is not a all-in-all solution for this.
So my question,
just 1 minute, if you can allow me,
this.
if you can allow me one rejoinder.
And just
I must tell you, Dr. Shruti, that old childhood
health setting is that if you in a good tertiary care hospital is that you have a medical backup. You can cover for anaphylaxis. If it happens in a pediatrician's clinic, the fear of vaccination, which already people are blaming blood clots and sudden deaths on vaccination, imagine what it would create.
I will completely disagree with Dr. Shruti here, that I must tell you, Faye, that the childhood vaccination program runs through pediatrician's clinic when someone wants to take it in private. And I must tell you here that you can develop anaphylaxis with every vaccine. Please let me complete. You can develop anaphylaxis with every vaccine. In fact, this vaccination has shown the least of the side effects of anaphylaxis. Not a single person has needed resuscitation, the type of kind you want. And childhood vaccines are given in public health posts where only sister or a nurse is there. So I think I completely disagree. I completely disagree with you to say that vaccination should be only done in tertiary care hospital. I think it's a completely futile exercise.
Okay, point noted. I just want to bring in Dr. Mangesh Pate. Dr. Pate, my question though about about the vaccination was, since we are seeing right now a second wave, which I think all three of you agree is a dangerous wave. So even if you want, if people want to argue that more number of people are asymptomatic, the ones who aren't, who are developing symptoms, there are people who are in fact dying. So there's no doubt about the fact that this is still dangerous. Dr. Pate, what is your stand right now about speeding up the vaccination process, however that process might be?
See, first of all, vaccination is necessary. Point number one. Dr. Nitin Shah as well as Shruti, they are on the same page actually.
Yes.
Number two, as quoted by Dr. Nitin Shah, I am also pediatrician. Okay. Now there is a definite need of increase in the centers, vaccination centers. I will tell you one simple example. What centers government or the local civic bodies have given today's date, there is a queue of 200 to 250 people at a time for taking vaccination. So these vaccination center themselves shall not prove a spreader for the disease. This is very important. So there is immediate need of increase in the vaccination center for sure, definitely. And as rightly said, Dr. Nitin Shah, Shruti has said one point very clearly. Let me tell you, I have been attending these all meetings regarding the vaccinations and everything. Whenever there is a vaccination center, there is a need definitely, because we are dealing with a totally new vaccine over here. We do not have a history of this vaccine, known history. What vaccines we use in the pediatrics OPD and the clinics, I'm a pediatrician like you, and I'm using all these vaccines. But this COVID vaccine is a new one. We all, including Indian Academy of Pediatrics and Indian Medical Association, we all support the vaccination drive and we are very much part of it. And what Dr. Nitin Shah has expressed very rightly, that we are ready to take up this challenge of vaccinating en masse to people. There are hospitals available which have got these facilities which are needed as a backup facilities. So it is not necessarily that it will be available only in the tertiary care facilities. There are facilities available in the private sector. Another point that slightly away from the discussion between three of us, that I will have to make one statement, a point of a caution over here. Whenever we discuss about the vaccination, the way it has been projected across the country, unnecessarily there has been the message given to the people that vaccination is absolutely safeguarding everyone. That should not happen. That is a very important point over here. This message we all as a professional must give to people, because what is happening, people are taking this vaccination as if they have got absolute freedom, just like a pre-COVID era. That is what the situation, everything happening everywhere. So we all collectively must give this message. That's what I will like to say over here.
In fact, there have been some reports that are coming in from across the country. So my parents, for example, were taking their vaccine today. They had an appointment. They went to that facility, but there were no vaccines available at that facility. It was not available. They had to then go somewhere else and do a walk-in with their IDs looking for the vaccine because they'd gone out to get it anyway. So there are some gaps definitely in the system. But I want to just bring your attention back to the fact that the government, and I'll ask you, Dr. Pate, I will ask you this question before I bring in my other two guests. The government and the health ministry seems to be in agreement that we are, in fact, in a second wave. Is this the second wave? And by your examination of the numbers, is the second wave likely to get a lot worse? And have we, because it's obvious, none of the state governments nor the central government wants to consider the possibility of another lockdown. We can't afford it economically. We have to be honest about that. So what happens now if the vaccine process is in fact slow, which we've all agreed, for varied reasons, maybe it's necessity otherwise, and the government doesn't want to do a lockdown? What happens in the ICUs? How bad is it?
First of all, Faye, I will like to mention again over here, segregate the two things, vaccination time, which is necessary, and a surge in the cases. These are the two different things. They are, even though they are interlinked, let us segregate them, because it should not give a false message to people which is already being spread over. There are WhatsApp universities and social media universities which is giving all these false relief to people, and that is the main reason for the surge in the cases. First thing.
Okay.
Second thing, whatever cases, amount of surge what we are seeing, there is no point, I do not see any point in discussing whether we are in the second wave or not.
Okay.
100%. Why there should be anyone doubts or even discussions on that, I don't understand. Third thing, as far as I guess you asked about the beds availability in ICU. What was your third point in the question?
So at this point, what is our option at, how do you
Lockdown.
think it's going to?
You said
Yes.
about lockdown.
Yes.
Okay.
Yes.
Let me ask you, whenever there is a surge, such type of surge, what you are seeing, everyone is discussing whether lockdown should be clamped or not clamped. Nobody is discussing the pre-lockdown measures, administrative response to the surge, how much it is being implemented and executed at the ground level, that nobody is saying. There are so many times I have come on your this channel and I have said, I repeat the same thing. The guidelines have come from central government, guidelines have come from the state government. There is a state COVID task force which is giving guidelines, ICBR is giving it. But when you come to the civic body level, how the implementation of the pre-lockdown phase is happening, you just go and see in the markets to the streets. It's pathetic. There is a need of there is something called as a instead of a complete lockdown in parts of the Europe, you see there are partial lockdowns being planned. So there is a need for the stern measures instead of a complete lockdown. Unless we implement it, unless we give our administrative complete potential in the execution, how can we speak of a lockdown? So that is my point.
But, Tandan, what you recommend at this point need to be taken in order to, let's be honest, just save lives?
I think we'll have to open up a lot of COVID care centers, which have turned into vaccination centers. So the number of beds has come down. We, as a community, of course, we will need to go in for more serious measures. And I think the referral system, which was there in place, was very strong about filtering patients, only getting sick patients, the one requiring admission. That needs to be put back in. I mean, now there are a lot of stable patients just out of the fear of the second wave, and the numbers who are getting into hospitals and the more critical patients are being left out. I'm not sure if involving the nursing homes again at the idea, because I think a lot of mess was created last time by mismanagement at nursing homes. I think maybe getting a nationalized protocol, because 1 year down the line, we're very clear about what works and what doesn't work. And maybe implementing that at a national level also will help, or at least at a state level.
Dr. Shah, what do you believe the steps are going forward that need to be taken? Of course, reiterating to our audience, wear your mask, sanitize your hands, maintain social distancing. But from a government, state or center's point of view, what do you recommend needs to be done, Dr. Shah?
According to me, we are into second year of the disease. Everyone knows how severe it can be and what measures you need to take to prevent. There is a limit to which you can stretch a human behavior to follow a certain guideline, including many medical persons I see not wearing the mask properly or not sanitizing properly, not wearing PPE at the appropriate places, etc. And that's the natural human behavior. So while we reinforce these measures, which are number one measures to prevent spread of disease from one person to other and in community at large, we must understand that if you really want to quickly get out of this mess, then you have to have enough number of people who are immune to the disease either by the natural course or by vaccination. And I again reiterate, this is a very similar to any other childhood disease where there are vaccines which are life-saving. You talk of influenza, you talk of any other pneumococcal disease or anything. We know certainly that of all the public health measure, the one which can reach fastest in the world, and that's true for even developing country as well as developed country, is the vaccination. So I reiterate that we need to scale up vaccination so that we can have a good herd immunity. If out of your population, if 70 to 75% of people have either got natural infection and antibodies or have got vaccination and antibody, in that short period, it will be able to help curtail down the transmission so that while you will continue wearing mask, sanitization, etc., avoid crowding, avoid going out unnecessarily, etc., but there is going to be a limit to which you can stretch anyone to do that. Do you think that if a 70-year-old man who knows that he's going to die if he attends a marriage party where people will be without mask for photographs and eating, and yet we have achieved in past, we have struggled with, say, breastfeeding, safe sanitization, safe water for drinking, good nutrition, no indoor pollution, no outdoor pollution, etc., and yet would not be able to cover, say, diarrhea or pneumonia, and you get the rotavirus disease in the vaccine in the national program, you get the pneumococcal vaccine in the national program, and you see next 3 years the disease just wipe off. So that is the potency with which vaccines can work and the fastness with which vaccination work. And now we have only 2 vaccines which are licensed, though we have another 2 or 3 which are banging the door. I think it's, if you can get emergency utilization authorization to 2 vaccines of good repute, you have another 2 vaccines which have proven efficacy. We need to open the door so that we don't have scarcity of the vaccines.
If we're
use the
completely
vaccine.
honest, Dr. Shah, if we're completely honest, and we have Anjan Rajan who has said that localized lockdowns and stronger backtracking needs to be done. Kerala has beat its second wave like that.
Correct.
But I just want to point out, we don't have a lack of vaccines. I mean, the Serum Institute is manufacturing enough right now for various countries, not just us. It's the process of dissemination that is
exactly, that's what I'm saying. So 60% of the vaccine manufactured is exported.
Mm.
So where is the scarcity? And that's only with 2 manufacturers. And that too, the second one getting the data of efficacy now with building up confidence in using Covaxin. And there are 2 more Sputnik vaccine banging on the door. There will be Novavax from Serum Institute of India. There will be a Zydus vaccine. There are already Moderna and Pfizer which are also asking for application of licensing. If you have no scarcity, just open up these vaccinations and try to give more and more people.
I have one more question for you. Today, the central government wrote to all state and union territories and told them to space out the 2 doses of Covishield from what was about 28 days to a month to now 8 weeks, because it increases the effectiveness of that vaccine. Absolutely. I will ask Dr. Pate how that happens, but does this also mean that more people will receive their first dose? Because we can have the first dose being handed out to more people because the second dose will now be paced out. Dr. Pate, would you explain to us
the second dose? In effect, it also means that less people will receive the second dose. So there are people who will be due for their second dose now, which will get postponed by another 4 to 6 weeks, Faye. And that was the reason why the government did not comply with this 8 to 12 weeks gap earlier, because they were worried that people would contract the illness. And this whole thing that we're talking about, vaccine preparedness, I think mentally as a population, we were not prepared for the vaccine. Dr. Pate and Dr. Shah will agree that the last 2 months, we have all been inundated by phone calls and messages from patients asking, should we take the vaccine or no? Is it safe or no? It's now because there's a surge in cases. This is human behavior, that now that we are hitting 30,000, that's the reason we are turning around and saying, okay, should we take the vaccine? Had we been proactive, there are a lot of healthcare workers, senior citizens who've been eligible for the vaccine for weeks. They've done nothing about taking it. These queues that we're seeing, we've seen them over the last few days and weeks.
Dr. Pate, how does spacing out the 2 doses improve the effectiveness of the vaccine?
See, this initial 4 to 6 weeks of spacing between the 2 dosages was postulated by the government. The similar thing happened in the European countries also. They had launched these vaccines much before India launched. And at the time when India launched these vaccines, that time itself in Europe, they had increased this spacing between the 2 dosages from 4 weeks to 12 weeks. There are studies available, they had published that time, that the immune response, they said they found to be rising to the level of almost 90% with the spacing with the 12. Dr. Shah very rightly said that initially when he had suggested, I know that he had suggested it, that this is because of the European countries that time. When we launched this vaccine, they had gone from this 4 weeks of spacing to 12 weeks. Now they have come down. They are saying not 12 weeks exactly, but 8 to 12 weeks. That's what they are saying. And now today, Government of India has given this advisory to the all state facilities that the spacing between these Indian vaccines should be between 6 to 8 weeks. They have not gone to 8 to 12 weeks. They have gone to 6 to 8 weeks. Now, this is because they must have had a backup data of immune response, which they are expecting after increasing the gap between the 2 dosages, we will get the better immune response. Second thing is that the phase 4 of the clinical trial, we still are awaiting the reports for the immune response, which is also another reason. And as Shruti rightly said, that government was scared if we from the beginning itself they go for this increase in the, there will be less people going for it. So that is the reason government has, and it is a very right thing. That's what I think. There say I am agar durust hai. Thank you.
Very well said, Dr.
But I must tell you that a lot of healthcare workers have taken their vaccine at 4 weeks, which is not the ideal schedule. So
Yeah.
they have been put to a disadvantage as compared to the general community. We have been crying hoarse to say it should be 8 weeks minimum, if not 12 weeks. And there is data from the original research, both in Brazil and South Africa, to say that between the two doses, if you postpone till 8 to 12 weeks, that was Dr. Shruti's apprehension, that there is an efficacy of the vaccine. And if you didn't have the vaccine for last 1 year, you still kept yourself away. You continue to do that between the two doses. But if your two doses can be given at 8 weeks, makes the efficacy jump from 60% to 90%. I think that's worth it. The other advantage is that because the second dose is postponed, enough time for the manufacturer to bring more doses, and you will have more people covered with one dose. It's always like that, that you give more doses to more people is better than giving the ideal schedule to very few people.
Well, we have one question I would like to address, and I think this is important because unfortunately we keep having these conversations, mixing politics with all of this. Jude Narona, thank you for your contribution of 1,000 rupees. This is how we pay salaries and keep our journalism independent, so we appreciate it. Gagan says, why is the Maharashtra government so incompetent? Is this second wave, to do with incompetence? Is this to do with laxity? Because the central government has pointed out, there are 3 points that the central government has pointed out. One, the people are not following COVID behavior. You're not wearing your masks. I have to walk out of the street to see people not wearing their masks. Masks on the chin, mask on the lower lip doesn't count. Not maintaining social distancing, not sanitizing your hands. That's one point. Second, governments are not doing what they used to do, which is test, isolate, screen people, and actually backtrack and trace where that infection has come from. That's the second point. The third point, could it be that this variant that we are currently experiencing is more infectious than the previous one? Is that what we're seeing? Why is it that that this second phase seems to actually, the numbers seem to be spiking more than the first phase, but it's not as scary as the first phase. So what are the reasons? Any of the three of you want to answer this question? Dr. Shah.
So if you really see the behavior of any virus, it will hit the first time. There will be a lot of people who are infected. They are scared. They are locked up. And remember, we had a very strong lockdown in India as compared to many Western countries. So we curtail it very easily in the next few months. Now, as I said, because human behavior now will not allow them to continue to keep this so strong and such strict isolation policies forever. They started mingling, huge marriage parties, people going out for vacations, people going to hotels and restaurants, gyms, train starting, metro starting, all is going to lead to more exposure. So a second wave was always expected. Because now people know how to control the disease, how to monitor themselves at home, people have become smarter, looking at the oxygen saturation, etc. There are drugs which are easily available, beds are easily available, so mortality has gone down as compared to last year. But the second wave is expected, and I'm telling you, at this rate, now you will have some lockdown here and there, cases will come down, a third wave will come after 6 months to 9 months. You take in writings from me, and that's what exactly the European people are saying, that you can prevent third wave if I have enough vaccines. The health minister of European Union is on this to say that if I can vaccinate quickly my population, I will prevent third wave. That is the possibility that we are going to have third wave, such humongous huge country that we are, and the type of people who have their behaviors which are so different, that be prepared for third wave after the second wave.
Yes, absolutely. Dr. Pate, it's impossible to shut down the Mumbai local. It's impossible to keep the people of the city, spaced out, because when they're going to work, we know how we're packed like sardines into the trains. There are states that are currently experiencing, going through their election campaigns. Large crowds are gathering together. Do you also expect second wave to turn into third wave because of the lack of COVID appropriate behavior, Dr. Pate?
I have got no doubts about this at all in my mind, first thing. Second thing, before discussing the third wave, we just have started the second wave. So let us concentrate on the second wave. And the future of the second wave, what is imminent in very much in next couple of months' time, I am very skeptical and scared. The way it is going on, if it continues like that, the soon we will have to conduct this sort of a session on some other serious issues. Remember my words. Whenever you spoke about this, it is difficult to stop Mumbai train, local trains. That's what you said. You tell me, what is the definition of administration? What is the definition of a channelization? If whatever population you are dealing with, whatever may be, if you put across the managerial channelization in whatever, it may be the Mumbai locals, it may be other local transport or markets, sabji mandi, streets, it is possible. Nothing is impossible. But local civic administrations across, they are not giving the results properly. That is the problem. People are not listening. It is absolutely accepted and agreed with Dr. Nitin Shah's statement. How much time you are going to keep people holding up? Agreed. Everyone is tired. But administration cannot say that we are tired. So we are not taking adequate measures to put the system, to put it a channelized way. That's why entire chaos are happening.
In fact, let me point out, like Dr. Shah had pointed out, Paris is in its third lockdown, and it's just entered a very severe lockdown as well. People are obviously disappointed that they're having to be locked down one more time through, through what is going to be their spring and summer. But this is what their government simply has to do. Dr. Tandan, like I always do, I'm going to give you the last word on, and you were obviously, you had said very clearly that even in the first round, that it is infuriating that people don't follow the rules. Are we at that point again? Because I find it infuriating this time that we know so much, we've been through so much as a city, as a state, as a country. We've seen our closest friends and family get sick. We've been terrified by the outcome. We've put our healthcare workers, our doctors, our nurses through hell over the last 1 year. And somehow we seem to have forgotten everything. And we're behaving like none of this had happened. We have no memory of what happened last year at all. Irrespective of whether our governments actually get their act together, whether the vaccine comes, doesn't come, to each of us and all of that, does it boil down to COVID appropriate behavior, Dr. Tandan? Should I just stay home and refuse to meet people? Because I can't trust where they have been.
Thank you, Faye, for saying this, because really what helped us to bring down the first wave was COVID appropriate behavior. There was no vaccine at that point of time. And we have to remember that is a time-tested methodology. Just to bring it to notice, Hong Kong is going through its fifth wave. And China was one of the first countries to have the vaccine. It's available there. Despite that, the surge continues. We know that the vaccine is just about as efficacious, whether it's 67%, 6 weeks apart, or 85, 90% later. If tomorrow I as a healthcare worker or my nurses stand up and say, look, we're sick of this, we can't do this. I mean, how does that appeal to everyone? Nobody could be sicker of COVID than the healthcare workers who are facing this day in and day out. And to say that, now it's time for me to go and party and to sit in a pub and go attend weddings because I can't face this sort of thing is really churlish. And for us to even encourage that and kind of endorse that kind of behavior, saying that how long we are adults. And, we have the example of the Spanish flu. It went on for 3 years. So COVID is not going to go away in a hurry. We've known this from the time it started, that this story is going to go on for 2 or 3 years. And if it just means, knowing the rules of the game, I said this before, it's a game of patience, COVID. Whether we lose our patience first or the virus loses its patience, and whoever retains it wins. So I think I'll just end on that note.
Absolutely. Well, a couple of questions that I would like to answer before we wrap up. Pranab Ganguly says, is the lack of vaccine production the reason why there's a new directive to delay the second dose? Pranab, the vaccine production is not our problem at all. In fact, we have the vaccine produced enough for a large population, but there's a block in the pipe in actually distributing. There's also Navnath Patil, who says, my parents and grandparents recently got Covaxin. What data do we have about the efficacy and safety, and what about the second dose in that regime? Any of you who wants to take this? Dr. Pate, do you want to answer these questions?
See, Covaxin, they just completed the phase 3 trial, and they have just now beginning of the phase 4 trial, and it takes quite a lot of time as compared to the initial phases for the phase 4 to get the data. So that will not be very wise to speak about the data for the phase 4, and unless it is available for us, we cannot speak or comment upon the efficacy and all those things.
No,
But
yes.
yeah,
But is there a problem? The second dose, the gap in the first and second dose of Covaxin, Dr.
no.
Patil?
Right now, what they have given is for the Serum Institute. This notification is
Yes.
for the serum vaccine. Okay, they have not come out for Bharat Biotech vaccine anything, nor they have commented upon anything about that. But I am very sure within a span of a next fortnight or so, you will receive the same notification about the Bharat Biotech vaccine also. Just wait for a while.
Dr. Shah?
No, I don't think that's going to happen because the data on Covaxin was very simple. All subjects in the trial received at 4 weeks interval. It showed 80% efficacy. That's it. Like your Moderna, like your Pfizer, like any other vaccine. The problem with Covishield was that because of the problem of one batch of vaccine having only half the dose, and because of the non-availability of vaccine during the trial, they had to by default increase the dose gap from 4 weeks to 8 or up to 12 weeks, and that gave them the window to study half dose versus full dose and 4 weeks versus 8 to 12 weeks. And they came out that if their vaccine was given at 8 to 12 weeks, it had 90% efficacy as compared to given at 4 weeks, which is 60%. That's the reason why we were all saying that if there is a proven data to make it 90% by just increasing the gap to 8 weeks, so we should give it in 8 weeks, as UK itself is giving it 8 to 12 weeks. So there is no confusion as far as any other vaccine is concerned, be it Moderna, Pfizer, Sputnik, Johnson Johnson, or the current Covaxin. It should be given at 28 days gap, and that's it. Unless you have shortage of vaccine, and then you believe that more number of first doses are better than giving 2 doses only to few, that's a different issue. That's not for scientific reason. Whereas increasing the gap from 4 to 8 weeks for Covishield is for scientific reason.
Well, I really hope that that is not a belief that anyone holds, because it's a very dangerous belief. Just like Vinay is asking this question, he says, is there any harm if someone doesn't take the second dose for whatever reason?
All the harm.
Not going to give you sufficient immunity.
It will be of no use.
So just to answer your question, Vinay, if you take one dose and don't take the second dose, you have effectively wasted the first dose of vaccine, wasted your time, and you're putting yourself at risk because mentally you think you're okay, but you are not any better than someone who has not taken the vaccine at all. There is a reason why the vaccine is being given out in 2 doses, not to inconvenience or bore you, but because the 2 doses are necessary in order to make the whole thing work. So please make sure, and I'm just going to try and put this all in a nutshell one more time. Make sure you behave like you behaved last year, which is sanitize everything that's coming into your house, wash your hands repeatedly, try and avoid going out, avoid crowds, sanitize your hands, wear your mask at all times, and be suspect of everyone you meet, because you don't know which wedding they have gone to and what they are carrying into your house. So be really, really careful, guard your family and everyone in your house, like you did last year where you were sanitizing every tomato that came into your house. It's, that's the kind of vigilance we need back again. That's first. If you are eligible for the vaccine, we have enough data. We did shows asking about whether or not we have enough data. Now there is enough data. If you are eligible for the vaccine, please make sure you go out and get it. If you have a parent who's eligible for the vaccine, please make sure they go out and get it. Please get the follow-up dose on time based on instructions that you have received from your doctor. If you are worried that you have blood pressure, you're taking aspirin, you're taking other things, go meet your regular physician, get a note from your regular physician, take that note to the vaccine center and show it to the doctors there and say, this is what my regular physician has told me, and then go ahead and get the vaccine. You are better off with the vaccine than you are without it. That's just the bottom line. And be prepared, buckle down for a second wave, which might be worse or as bad as the first wave, which means we need to be on guard. Doctors, thank you so much for answering our questions. I really appreciate it. I do hope that people will remember to follow COVID-appropriate behavior. We shouldn't have to lose lives as a warning for the rest of us to behave ourselves. That's actually quite unfair. And this is a collective responsibility that we all have to, in fact, maintain. So yes, it's starting with Maharashtra. Remember, this is how it started the first time around as well. Kerala, then Maharashtra, then Delhi, and then other cities. So Kerala has already battled that second wave. Maharashtra is now seeing numbers we saw last year at exactly the same time. Rest of the cities should be very, very, warned and cautioned by it. All right, we're going to leave it there. Thank you so much for joining us, doctors, and answering those questions. For our audience, at 9 o'clock this evening, we bring you an update on everything that's happening in Maharashtra, outside of COVID as well. The COVID update is also in the news, but everything that's happening in Maharashtra to do with the government, the police, and the unfortunate situation that citizens of Mumbai are finding quite embarrassing. If you ask me included. All that update is on our news at 9 o'clock. Do remember to catch it. Share these videos with people you think will find it useful. Thank you for watching. Good night.
Thank you.
Thank you. Good night.